So this week's news story on the compounded medication, legal or not? This seems like this is changing at this point in time weekly, and it can be hard to keep up with information. So we all know that by October the 3rd, the FDA had taken this medication off of its shortage list, which means that the compounding pharmacies, specifically the 503A patient-specific compounding pharmacies, had to immediately quit formulating this medication, and so they were only able to ship out the medicine that had already been compounded. The 503B pharmacies, which is the bigger bulk pharmacies, were given a 60-day period to where they could get their prescriptions in order, and then they were going to stop formulating the medication also. However, there have been recent new developments. Most recently, on October the 14th, the FDA states it is reconsidering calling the shortage resolved in response to a lawsuit that was filed. So does this make it legal? Well, as a making of this video, that appears to still be unclear for these pharmacies. It's unclear if all of the 503A pharmacies are able to start formulating the medication again, or if it's just the pharmacies that were involved in the lawsuit. However, I can tell you that it appears most of the pharmacies are beginning to reconstitute this medication and make it available to their patients, as it's getting much easier to get than it was last week. The court is set to reevaluate the case November the 21st, but as of now, it seems to be that patients are able to get their compounded medication. So make sure that you stay up to date and subscribe to the channel as things are changing rapidly so you can keep up with the availability of the medication.